Something else we're watching, Mayor Tory is asking the city's public health officials to see if a plan can be worked out to safely reopen gyms. The mayor calling it a public health issue, especially as we approach those winter months. He wants a general reopening strategy to potentially come as we get out of this stage 2. So let's break this all down. There's a lot to discuss. Mayor Tory joins me live now for his weekly check-in. Good morning to you, Mayor. How are you?
Good morning, Mel. I'm fine. How are you?
Doing well. Let's begin with the gyms. There's a major movement. We've seen it from the big players like Good Life to some of the smaller boutique facilities who have all said, listen, I don't know why we're not being lumped in with, say, something like a dance studio. We are taking all the precautions. So can we talk a little bit about the protocol or the procedures that you're looking at right now alongside public health to potentially look at some reopenings?
Well, first of all, public health, I've learned from Dr. Davila, is something you look at in a much broader context. It isn't just about COVID, although right now that's a focus, but it's about your state of well-being, your other state of physical well-being. It's about things even like your financial status, because if that's got you stressed, then you're not going to be as healthy as if you were in better shape financially. So public health is a very broad context, and part of what that involves is keeping yourself fit. And a lot of people do that at a gym. Now, we have an absolute obligation to make sure if gyms are open, that they're open safely. That's why the whole approach that I'm taking of getting a scenario for the post 28-day period is called doors open safely, with safely underlined 5 times. But I'm of the view that there must be ways in which we can find to open restaurants and gyms safely. And that may mean under different circumstances than just as per normal. And then try to keep them open, because I think a lot of the rest of that's been difficult for people has been both the users and the owners of these businesses is opening and closing and opening and closing. So we're really trying hard to come up with some kind of a plan for the end of the 28-day period, which is coming up quickly on us, where we can have things open, stay open, and do it safely, which is really, really important. And that may mean, reduced numbers of people in the gym. It may mean no group activities. It may mean in restaurants, even fewer tables, or tables that are even further apart, or some restriction on sort of what time you can be at the tables and this kind of thing. But they're working on those plans because I asked them if they would bring some forward so that we could consider them with the province and see if we can do something that's going to be a balanced kind of approach with a big focus, obviously, on health going forward.
Of course, the last thing you want to do is move forward and then move back again. So we'll figure this one out. But also with that, we're talking about the struggling restaurant industry. We talk about, in fact, the same thing every week because it's such a big problem. So we know that the passing of the Cafe TO to move that program into the spring. So that's some great positive news for those who can accommodate. But when it comes to those fees from the delivery apps, obviously that passing through council, what are the next steps now when it gets taken to the province to potentially legislate something?
Well, I hope it helps, Premier Ford, because he has said, like me, that he finds these fees to be just not appropriate and not acceptable at a time of pandemic when all these restaurants are struggling. And these restaurants are the customers of these companies that charge these big fees. So I hope that a unanimous resolution from the Toronto City Council will help to put some wind in the Premier's sail in terms of saying, well, we're going to deal with this, because we've given the companies plenty of time. I phoned them all back in April and said, would you please consider doing something with your fees to help these restaurants? And they've brought in, some measures here and there kind of around the edges, but on the fundamental 30%, commission that comes right off the top. So I don't know if people out there watching, BT know that when you order one of these meals and you think you're helping these restaurants, and indeed you are just by doing it, but 30% of that comes off the top, by way of a commission, depending on which app you use. And so if you think of the restaurant, they're left with the money you paid for the meal minus 30%. And in many cases, this is less than the cost of them, putting the meal together. So I just think it's time, in these really, really tough times, that these companies move to do something that I think is an act of good corporate citizenship. And it is also working to preserve their customers. The customers they have are the restaurants. And if they're gone because they went out of business, then I think these food delivery firms will be much worse off when the pandemic is over.
Absolutely. Last week, we chatted just before you got your flu shot. We're hearing some reports of some shortages at various places like pharmacies. I know the city has added another flu clinic. Do you anticipate more of that?
No, and the reason I say we don't anticipate more of city clinics is the city traditionally through Toronto Public Health has been the deliverer of a very small minority, mostly for particular populations like shelter populations, long-term care homes, and so on. The vast majority over many years of the distribution of flu has taken place through doctors' offices and pharmacies, with the province having the responsibility for the distribution of the vaccine. So we don't anticipate having more city clinics because that just isn't the established distribution network. And, you have to be optimistic that the the province is going to get the distribution, because they've certainly ordered lots of flu vaccine, get the distribution, to where it needs to be, and that you'll have people. I think part of the reason why it's a little more challenging this year for people is that the things are being done by appointment to avoid crowd scenes in doctors' offices or pharmacies, and I think that's making it a bit more challenging. But everybody's working hard to make sure people can get that flu shot, which they should try to do.
Absolutely. I want to get your take on the police body cameras, the wearing of them. We know it was rolled out in one division, or was it two divisions previous? Three more this coming Monday. Yeah. Do you have an idea on progress and how this rollout's going to work?
Well, I mean, the progress is happening slowly but steadily, as you can see. 3 more divisions added yesterday, and I think that the real, test here is going to be when we actually start to use the content, because either some incident has happened that requires a review of what happened, and also it's going to be interesting to see how the officers are using them out there. They have some protocols they have to follow with respect to when they're turned on and turned off. And so I think this is going to significantly increase accountability on all sides. I think it is going to eventually help rebuild trust in police, which has been eroded in some quarters. So I think it's a good thing. Notwithstanding the debate, it is a relatively modest investment if we get a significant improvement in trust in police, which I think is, at the end of the day, what we're trying to do here.
I think it's very much needed. As you mentioned, it's a time right now when that relationship has been fractured in some of the communities, and so we need to rebuild and repair. Okay, before we let you go, Mayor Tory, usually we say goodbye, but you're going to stick around for just a minute because we want to get your take on a bright spot.